Welcome back to the Dentist News Network. I'm Scott Drake. My guest today is Dr. Pat Rabot with the North Scottsdale Center for Oral and Maxillofacial Surgery. Dr. Rabot, it's good to see you again.
Thanks, Scott, for having me again.
We've been spending a lot of time in recent videos talking about wisdom teeth. Let's go over some of the possible complications that can arise.
Scott, complications with wisdom teeth are extremely rare, but they do occur. Probably what most people hear from other people that have had wisdom teeth is certainly the swelling. In cases where the wisdom tooth is impacted and they have to make a flap in the gum and remove a little bit of bone to get to the tooth, many times you'll have at least 3 days of post-operative swelling. That swelling can hopefully be controlled by just placing ice on the face to try and keep the swelling down. But it develops late that night or early the next morning after the extraction. That will be there for about 3 days before it even starts going down. So don't be too alarmed if the next day you're more swollen than it was the day of the procedure. That's really the most common complication of having the wisdom teeth taken out. Other things that can happen certainly is when you make an incision in the gum or anywhere on the body, you can have bleeding and you can develop an infection. The bleeding usually stops and clots after about 8 to 10 minutes, but it tends to ooze for about the next 24 hours. So when you spit, you may have a little bit of, notice a little red tinge of blood to your sputum, and really not to worry about that. But it really should not be welling up in your mouth and having a lot of blood. Certainly most of the bleeding is controlled by direct pressure with the gauze that your doctors give you to help put direct pressure on those. Sometimes a tea bag that's moistened, and it doesn't matter if it's caffeinated or decaffeinated, over that area, the tannic acid will help you clot even better. So you can utilize that if you feel like you're oozing a little bit more. The third complication is infection. And most of the surgeons, if an infection arises, can place you on an antibiotic, and some place patients on antibiotics if they have an existing infection or chronic infection around the wisdom tooth as it's being taken out or before it was taken out. Another thing that can happen is there's a nerve that runs through the middle of the jawbone, the lower jaw in particular, and it's called the inferior alveolar nerve. It's a large nerve that runs within the lower jaw. It enters on the side towards your tongue in a small opening and then runs through the middle of your jawbone. And when I move this back, you can see where the course of the nerve runs right by where the wisdom teeth are at. Sometimes with an impacted tooth, especially ones that's been allowed there to develop, where the roots develop further down around that nerve can be injured. If the nerve is injured, it results in either a permanent numbness, but usually a temporary numbness in the area of your lower lip and chin on either side, depending upon which side of the jaw the injury took place. Now, those injuries are very rare, and most of the time they're identified early on. If it's just from the trauma of taking the tooth out, that usually resolves within the first 6 to 8 weeks. However, if there's an actual injury to that nerve, the surgeon can identify that and hopefully repair that immediately or within the next several weeks. With the upper jaw in particular, you have a sinus. You don't have a large nerve back there, but you do have a sinus. And that sinus is very large, and it's above your posterior teeth. And sometimes the roots will actually be within the sinus floor. So when you take the tooth out, it can leave a hole in that floor. But really, very rarely is that a permanent issue. Only about 1% of the cases where that becomes exposed do we have to actually go in and close that hole. Probably the rarest complication would be injury to the lingual nerve, and that's another nerve that's just medial or on the tongue side of the lower jaw. And it kind of follows this groove right in this area here. It comes in close to the nerve that runs through the middle of the jawbone and then comes into the floor of the mouth and then innervates the anterior 2/3 of the tongue. And so sometimes when you're getting an injection for a filling, you can get an electric shock as that medication depolarizes that nerve, causes it to depolarize, or actually sends a jolt down it. And many times a patient will say that they felt a little electric shock either in the tongue or in the lip as that injection is being carried out. But that's a very, very rare injury that can occur. Probably the most common complication in removing wisdom teeth, other than swelling, is a dry socket. And anyone that's had a dry socket has certainly spread the word through all of their friends. And what that dry socket is basically this. When we take a tooth out, we would like a nice blood clot to fill in that hole. That's why we put a stitch in there to hold the gum together. We put gauze on top for direct pressure. But in some cases, that blood clot can be lost, or maybe it doesn't form and just leaves a bony hole. Now that bony hole results in a dull throb. It develops about 3 to 5 days after the extraction. So once the swelling goes down, if the throbbing gets worse, you may have a dry socket. In which case you go back to the oral surgeon and they can evaluate it. They can irrigate out the extraction site and put a nice sedative dressing in there to get rid of the pain. If we did nothing, it would heal up fine. It would just throb for about 2 to 3 weeks as it was healing.
All right, doctor, thank you.
Thanks for having me again, Scott.
My guest has been Dr. Pat Rabot with the North Scottsdale Center for Oral and Maxillofacial Surgery. I'm Scott Drake, and you're watching the Dentist News Network.